So nice to meet you. I'm happy to open this important webinar from the World Association for Sexual Health. And in particular, the fact that this particular webinar has to do with science. Science in the World Association for Sexual Health. And it is important to underline the importance of scientific activities in the World Association for Sexual Health and the importance of the scientific committee inside the organization, the team, the staff of WAS. It is important because WAS is the only organization in the field of sexuality, sexual health, sexual rights, sexual justice, which grounds its activity on science, which means that every statement that we pronounce, that we publish, every declaration, every presence in the world, every word that we say is based on evidence, it's based on science. And this is important because, as you know, WAS is experiencing an important turn with more important importance given to human rights, sexual rights, and justice, sexual justice. And this is important because it is not a rupture, a disruption from the history of sexology. It has to do with a very, very basic combination of sexual science when it started in Germany in 1919 with the Institute for Sexual Gesellschaft, Institute for Sexual Health, held by Magnus Hirschfeld in Berlin, which had in this mission, and I would say in its DNA, the combination of science and emancipation. And the idea of Magnus Hirschfeld and the Society for Sexual Science was to put science at the service of emancipation, which means that emancipation needs to be based on evidence-based knowledge to go beyond all the fake news, the taboo, the misconception. And we know, as scientists, and I am a social psychologist and anthropologist, we know that many in the field of sexuality is overloaded with fake news, misconception, and taboo. So it is, and the fact itself to produce some knowledge, some valid, robust, evidence-based knowledge is in itself an act of emancipation because it helps to help people to clarify the opinion they may have and to have much clearer idea about sexuality. So I will not speak longer than that because we have the current WAS scientific committee who is on the floor today, and it is important to let them express where do they come from, what did they do already, and what are their plans for the near future of WAS. So thank you, and I'm happy to introduce Professor Erick Janssen from the University of Leuven in Belgium, who is going to organize this important symposium. Thank you.
Thank you so much for that very nice introduction, Alain, also with some historic references. I have some slides that I will share if I succeed. So I want to share some thoughts with you, largely, departing from our previous meeting in Turkey, and but also some more general thoughts about the role of sexual science, where it is heading, positive and maybe not so positive developments. The role of the scientific committee is let me see, sorry. Of course, I hope many, if not most of you, attended the meeting. If not, I hope you will be able to enjoy all the information that's available, including the abstract book, which we are still working on it being published soon. I also want to point out that we want to hear, definitely later during this webinar, from you as well. We want to hear your thoughts about the meeting, the program, where you think we're heading as a community, people involved in sexual health, sex research, and related areas, clinical work, as well as more scientific research. We want to hear your thoughts. So you can already start putting things in the chat if you want, and then we can get back to that later. Of course, WAS as a mission at its core has the mission of promoting and advocating for sexual health and sexual rights throughout the lifespan and across the world by advancing sexology and science-based sexuality knowledge, research, comprehensive sexuality education, clinical care, and services. Obviously, a lot of what we try to accomplish in this world is based as much as we can on evidence, on things we have discovered. For some reason, my slides are progressing automatically. I don't know why. So, but we are, the scientific committee consists of a large number of people who all have been involved in organizing the conference, who are all involved in reviewing the work of people who submitted for presentation. And we are very, very grateful to all of these people you see listed here. In fact, we have an even larger extended family of people who help reviewing the abstracts for the meeting. And here you see this long list, very internationally representative in many areas of the world, all volunteer work. So we are very grateful for that. This is a little word cloud of all the words I took out of the titles of the abstracts and also the keywords to get a sense of what sort of topics are, or what kind of words obviously are included and represent the content of presentations. This cloud doesn't necessarily change a whole lot from conference to conference, but there are small changes, things, words like pleasure, we're seeing more and more in abstracts. Obviously, there's always been research related to sexual violence, dysfunction, pornography, but more and more attention is given at the meeting. So through research, but also through presentations that talk about policy efforts and other activities involving youth and adolescents and students. Obviously, our area is very broad in scope, and also, people work from various perspectives. We try to, make sure that all those different areas are represented at the meetings, and we do that through the creation of tracks. Here you see the 7 tracks that we currently have: sexual rights and ethics, social and behavioral sciences, clinical sciences and therapy, basic science, sexual medicine, public health, public policies, and education. Of course, there are all kinds of different ways to organize this, but it represents to a large degree areas that people are professionally engaged in. I want to illustrate some of the developments through the abstract awards of the last meeting. So for every track, we chose, based on the reviews and the scores that were received for the different abstracts, one presentation to receive an award. And you see already a lot of variation in topics and interesting developments. So the first one given to Najin Damabi and colleagues on sexual function in women from migrant and refugee backgrounds. This is a increasingly important topic, sexuality, sexual health, sexual rights in the context of migration and related motivations of motives for basically moving around the world and how the world responds to that. The second, social and behavioral sciences, the paper or the presentation that received an award was Conceptual Background and Psychometric Properties of a Sexual Pleasure Measure. This is also a relatively new development, focus on sexual pleasure. I think we can talk about that quite a bit more. Sexual pleasure is something that people have been studying and been promoting from various perspectives, including sex education, even, but also, of course, just more clinical perspectives. But we see more and more on this topic. At the same time, the scientific part, the scientific focus on this is relatively new, and how to define it, how to operationalize it, how to measure it is actually not as easy. And Marlene Werner and colleagues are among people trying to really change that. So that is a new development, the theme of sexual pleasure, which is going to be, I think, more and more important in all kinds of different contexts, even in the context of consent and sexual violence, and sexual pleasure as a guiding principle, more or less, for interactions that can only be pleasurable if they're pleasurable for both or for all involved. This is a thought that I've been having about this, why sexual pleasure is relevant beyond mere enjoyment of a sexual activity. It has implications that are much larger. The third track, clinical science and therapy, predictive value of maladaptive cognitive schemas and sexual dysfunctions on women. This was a paper by a presentation by Stancia Camelia and Delcia Christian. And I think research on sexual dysfunctions is less prominent these days in terms of more basic research in the area of sexual health and sexuality. And it is nice to see that people are still doing work and trying to understand very basic processes that are related to sexual arousal or problems with sexual response. We may get back to that. So that is not necessarily a new development, but it's good to see that it is still something that is taken seriously. Basic science, that track, paper on patterns of genital and subjective sexual arousal, in cisgender asexual men. I think this, to me, represents a new development in that increasingly in our studies we have to incorporate and think about how to approach gender. The bulk of research on sexual response, sexual functioning that exists in the literature, English language literature, is basically focused on cisgender, heterosexual men, heterosexual women. And we live in a changing world when it comes to the dimensions and categorizations of gender. And that, I think, is a development that we will need to do more for and more on, to incorporate all the variations that exist in gender, and how do you deal with that in your research and questionnaire studies and lab studies, and anything is something that is going to require work. In this particular case, the study focused on asexuality, which of course there's a bit more research on, but for example, more basic studies of sexual response, arousal, etc. In non-binary people is virtually absent at this point. Okay, I'll try and speed up because I have a lot of other things I want to address, but the sexual medicine track, the impact of breast cancer treatment on sexuality, is also good to see there's continued interest and focus on clinical aspects and chronic and other diseases. There was a study by Luca Rinaldi and others, and the previous one by Morak, Yurul, and colleagues. public health and public policies, the association between women's empowerment and female genital mutilation abandonment, a multi-country study. FGM is a topic that is very important, and to look at this from a research perspective, obviously, is hopefully going to inform and help people making decisions also at the policy level. And the last abstract award went to Maria Lowen and colleagues for research on masculinities and sex education. This, in the context of gender, I think is also an increasingly important topic. Here it is about boys and girls, but God knows what we will see in the future in titles and descriptions. And I think we need to increasingly try and be inclusive, but also it will require, from a more scientific perspective, a broadening, a widening of our theoretical frameworks. On the base of what do we predict? What do we expect? Is it mostly an exploratory work that we want to do in the context of gender and its increasingly expanding nature and expression? Or where our theoretical frameworks and ideas for trying to help us as scientists, researchers, clinicians, policymakers to make sense of all that diversity? So in general, I just wanted to highlight some of those abstracts, mostly to show that even within our previous conference, we see new things and we see continuing things. In general, when we talk about developments, I think we often think about everything that's going better, everything that's new, but there are also things that disappear and maybe not always for the right reasons in terms of our attention, in terms of our focus, what we think is important. And I want to just reflect a little bit on that. So I already talked a bit about the connection between sexuality, sexual health, and gender. Gender, and the second topic is actually kind of connected to that. Now, to what degree do we have to think in this world in terms of categories versus dimensions? We can talk about sexual orientation categorically. I'm heterosexual, I'm homosexual, versus more dimensional, as Alfred Kinsey tried to encourage us to do. The same applies to gender, and to what degree are we thinking about gender in different categories, and we just expand the number of categories. Sorry, the slides just progressed by themselves, I don't know why. Versus to what degree should we explore gender also from a more dimensional perspective? Those are things to think about. Cultural differences, similarities, I'm including that here because WAS is one of the most global organizations in our field, possibly the most global and most widely spread in terms of its members around the globe. And there's a lot of research in different parts of the world, and we explore locally within the local context all kinds of problem areas related to sexuality or positive things related to clinical problems, but also to relationship quality, etc. There's not much integration, I feel, in the literature on to what degree can we learn from all those different studies from different parts of the world, something more general about, apologies for the term, but the human nature, and to what degree can we learn from it indeed more about the influence of cultural, local influences. There are a lot of different studies, and it's like a beautiful mosaic in the literature. But what exactly the picture is of that mosaic is showing us is something we can work on more, I think. And I feel that's a little lacking in general. Like a lot of different studies in different cultures and countries, but what does it tell us from a larger perspective? Technology is also something in the abstracts. Increasingly, of course, we live in a digital world, but not everybody does. and from a research perspective, there's so much that is happening and that's changing, from texting to nowadays the role of AI in porn production, etc. But and this is probably not something we can avoid, but researchers, we sort of chase those new developments. We try to catch up with them and try and make sense of them. We're not really in charge of creating those changes, but also there, theoretically, I think we could work more on developing frameworks that will help us put all those new developments in a more understandable perspective for ourselves. I'm adding this topic of values, norms, science, and knowledge because I think increasingly we live in a very polarized world, and values and norms are important, and we should actually take those very seriously. But at the same time, decisions about what is allowed, what is not allowed, what are people free to do or not, what do we think is acceptable, what is not, what directions we should go in with education or even clinical treatment should be based on science as knowledge as much as possible. I don't know I don't actually know where I'm with my time, so I will try and round it up, but I don't know. You could stop me if I'm going too long. There's still a lot of areas that are very important where a lot of research is happening, but where we're still struggling with definitions, theories, how to understand the determinants of sexual violence and aggression, but also assessment and treatment in clinical practice. We still keep changing our diagnoses, or what exists, what doesn't exist. Hypersexuality, sex addiction, how do we think about those things, how we study those? Some things have disappeared from the DSM and the ICD, so I guess they don't exist anymore, but people do have all kinds of concerns, and I think there's still a lot of research to be done. Also, I'll talk a bit more about it in a second, the translational aspects. Sexual rights, sexual justice, sexual well-being, how do they really connect, and what do those terms really represent and reflect? How precise can we be about them? Sexual well-being is a great example of something we all think is very important, but how to define it is one step. Then how to actually translate into something that is measurable for research purposes and then actually can be used again. The data that we collect to inform further decisions about how to promote it, how to facilitate the implementation of programs that will help improve it. Those things are still challenges and will require continuous efforts. Funding is always a problem, because if there was more money, we could do more things. We could have larger samples, we could do bigger studies, we could also often possibly do better studies. We're dependent on governments, federal, local. Of course, historically, I could talk about this for a long time. The funding also is important, not just because it allows us to do research, but it also kind of, to some degree, culturally sets the agenda for what societies consider important research, where we should go and where we should not go as scientists. Translational work, I want to say just about that I think this is still a challenge. It's a development. There are good developments to be seen in this regard, but also there's a lack still, I think, to a large degree, in communication between basic scientists and how to use research on, for example, sexual aggression or sexual function or sexual response, to new ways of thinking in terms of clinical practice, treatment, prevention programs, and education. I think we need more effort in that respect. And it does mean, we know from, for example, sexual aggression prevention programs that they are not as effective as we had hoped. And that partly has to do with still a lack of understanding of basic mechanisms, the determinants of the behaviors, the contextual factors. So I think there has to be more dialogue and interaction between research and people who do applied work. Then a little thought here, like, of course, we use the word basic science a lot. I actually would like to say something provocative about it, a little challenging, because we think of basic science often in terms of numbers, more essentialist scientific thinking, focusing on mechanism, determinants. But to some degree, when you do qualitative studies and you really try to understand what consent means to someone, or what satisfaction or pleasure means to someone, personally, I would consider that also basic science. This trying to, we're trying to capture really basic understanding. And I put here, e.g., sorry again, psychonomics on the bottom of the slide, because that's my background. I studied psychology, but also psychonomics. And many years ago, that was exactly about those kind of things, but from maybe a different methodological perspective. But it was about questions like, what do things mean to us? How do we interpret the world? How do we know the meaning of words? It involves perception, it involves memory processes. And so that is basic science, trying to understand very basic processes of how we give meaning to the world we live in. But that's also what qualitative researchers try to do. Of course, even from a more social constructionist perspective, where language plays a very strong and important role. But in a way, why would we not consider that also basic science, trying to understand very basic meanings and concepts and constructs, and also how people interpret them?
Hi, Eric. Sorry
yeah.
I'm helping to moderate. If you can start closing, please.
I'm wrapping it up right now. So I have a lot of thoughts about this, and it's actually it's hard to share those in just a few minutes, because I probably could go on for an hour and a bit more structured. But so I think, in terms of new developments in sexuality research and sex research, sexual health, etc., very few research questions or topics may be truly new. Understanding of the basics of sexual function, sexual behavior, our sexual experience, but the context in which they are studied and the degree to which and under what conditions society, both as a source and a result of cultural and political forces, allows them to be studied, how they are prioritized or ignored or even censored, does continuously change. And we see that happening in many parts of the world. And that part about our work is always new. So even if the questions may look different, like, can you get erectile problems from porn or use, etc.? Can you be sexually addicted? A lot of those questions go back to very old questions about, what the regulation of sex and where things can go wrong in terms of our experiences and our behaviors. And also the positive aspects have been studied for a long time. But the context in which we do our work is very challenging, and people respond to that with their research and the policy making efforts. But I think, I don't have to say much about this. Sex education has always been very polarized, but it remains a challenge. And in many countries, even in Europe now, it is extremely polarized. And there's a lot of even violence towards people who try to do this work, even in countries like Belgium and the Netherlands. So it's not always easy to do our job living in a world so mixed in its reception of our efforts. But it's crucial we don't give up. And I'd say keep up the good work, and let's keep trying to develop new ways of exploring the world and helping improving sexual health around the globe.
Hello, everybody. My name is Renee de Klerk. For those who don't know me, I am the Executive Director of WAS. And I just want to thank everybody for being here. I see that we've been more than 100 people together in this webinar for most of the session. But for those of you who joined us a little bit later, because I do see the numbers of people coming in fluctuating a bit, let me just explain to you a little bit of what happened so far. So the first speaker was Alain Giami, and he's the Vice President of WAS. And he was also for a very long time actually the chair of the scientific committee. And then from there, Erick Janssen, who's our current chair of the scientific committee, took over, and he now gave us a wonderful talk on where we are going next and his reflections on the research that we saw at our Congress last year in November. So the next speaker that I am going to introduce, and it's a privilege to introduce Kristen to you. Unfortunately, she cannot be with us live today because of daylight savings time and the difficulty of working internationally, but she's done a recording for us. So for the next 16 minutes, we will listen to a video that Kristen has made for us. I'm just going to tell you how wonderful Kristen Mark is. She is a professor and the Joycelyn Elders Endowed Chair for Sexual Health Education at the Eli Coleman Institute for Sexual and Gender Health in the Department of Family Medicine and Community Health at the University of Minnesota Medical School. And she also serves on the advisory committee of WAS, and she is also the vice chair of the scientific committee. So let's sit back and enjoy listening to Kristen's reflections.
Hello, everyone. So wonderful to be here with you today. Thank you for joining us for Reflections on the Scientific Program from WAS 2023 in Turkey, and also the opportunity to talk about where things are headed next. So I'm Dr. Kristen Mark. I am the Scientific Vice Chair for WAS and a member of the WAS Advisory Committee. I'm also a professor at University of Minnesota Medical School, where I hold the Joycelyn Elders Endowed Chair for Sexual Health Education at the Eli Coleman Institute for Sexual and Gender Health. I'm going to take the next 15 minutes or so to talk about the highlights of the Congress in Turkey for me and how it relates to some of my own research, but also what I see as important routes forward in sex research generally. In particular, I'd really like to take time to focus on three sort of aspects of the program that I really appreciated and enjoyed talks from. So that includes sexual function, sexual pleasure, and the training of future healthcare providers. These are connected to me, and so I plan to try and articulate for all of you how those are so connected throughout the course of the next 15 minutes or so. So, as many of you in the audience are far too familiar, healthcare often forgets sexual health. Right? We've had to really fight for sexual health to be considered as a component of overall health and well-being. And although this seems like common sense to all of us, it isn't necessarily something that's common sense in many parts of the world or even across different populations of people within certain areas of the world. So, for example, I teach medical students at the University of Minnesota. And some of them are so on board with the idea of sexual health as a component of overall health. Some of them are so excited when they see me, the sex researcher, walk into the room and they know that they're going to get some content on sexual health. There's another group of students, and I think this is the case at any medical school or at any school, right? Where they see me walk into the room and there's sort of this sense of like, oh, like that nervousness or dread of what are we going to talk about this time? And I think that is in part due to a lack of connection that's been formed for those students in how sexual health and sexual medicine are related to their practice of medicine that they intend to go into, right? Our society, this applies to societies across the world, doesn't see sex as a natural part of human development. There are some places where they do, certainly not the United States where I'm based, but instead as something that one might be ashamed of or something that is something to stay hidden, right? So that is part of my job and part of many of your jobs to sort of provide that link and give a clear sense of what it is that is important about what you are communicating to those students that is going to be applicable in their future work. So I planned to feature some of the work that was presented at WAS that I'll be able to continue to use in my efforts in training future healthcare providers. And then I'll also talk about a symposium that did cover that topic specifically. So I think, within our field as well, we tend to see that sexual health has not always included sexual pleasure, right? The declaration of sexual pleasure was a big step in the direction of normalizing that link and of giving some weight to that link in a way that I think has made a really big dent in how the world views sexual pleasure. Sexual function for a long time focused on the dysfunction rather than looking beyond that to the resilience or the pleasure or the orgasm and well-being. And fantastic work has been done in recent years to further clarify the measurement, the importance, the correlates, and even the theoretical approaches to sexual pleasure and well-being. And so I look forward to seeing more of this at the next WAS meeting and hearing about how far that area has come, even from this past year to 2 years from now. So let's begin with talking about sexual function. One of the presentations that I really enjoyed, and I always enjoy hearing from Dr. Laurie Brotto, is an invited plenary session from Dr. Laurie Brotto, who gave a talk summarizing her impressive body of work in sex and mindfulness. She reviewed the literature on mindfulness, so she talked about her work, but also reviewed the work at large on sex and mindfulness, and using this as a treatment for sexual dysfunction and for vulvovaginal pain in women, but also talked about how this applies to sexual desire issues. Many of you may have seen her recent book. I guess it's not quite so recent anymore, but the book on mindfulness and sexual desire, and better sex through mindfulness. Sorry, the title was escaping me for a second. This book is really clinically relevant and really helpful for clinicians. And in that book, and also in this talk, she analyzed 20 years of studies carried out by her lab at University of British Columbia, the Sexual Health Research Lab, and also provided some context with these key meta-analyses on the topic of sex and mindfulness at large. What she presented to us at WAS was that there's really very consistent and compelling evidence that mindfulness-based interventions, they do improve sexual desire, they decrease sexual distress, they help to mitigate vulvovaginal pain, they minimize the experience of catastrophizing, and she also extended this to other areas, other facets of quality of life in women with sexual dysfunction or who are experiencing pain. So that talk really gave a nice summary of this and provided a framework to think about how to move from the sexual dysfunction into other facets of quality of life, looking at sexual well-being, and moving into sexual pleasure. Another talk in the area of sexual function that was really interesting for me and to hear about was from Dr. Pedro Nobra, who gave an invited keynote on sexual health, well-being, and quality of life. And Pedro also presented the Portuguese implementation of the World Health Organization's new sexual health assessment of practices and experiences called the SHAPE scale. And this measurement tool was also featured in the program through a talk from Dr. Leanne Gonzalez from the World Health Organization, who took time to discuss exactly how this important measurement tool was created and then how it was field tested for reliability and validity. She really, in her talk, she talked about how there's such limited data on sexual practices and behaviors globally. And additionally, what ends up happening is that the data, even in higher income countries where they are perhaps collecting these data, people aren't using the same measurement tool across those different sites. And so it makes it really difficult to compare over time, or to be able to compare one data set to another, or to converge different findings and ensure that we are, I mean, these are all very important ways that we can ensure that our results are sound. And so the World Health Organization and HRP initiated this consensus building process to identify the core elements and content areas that were necessary for inclusion in a global survey. And they developed this tool. They started with cognitive interviewing, and they ended up going through 600 cognitive interviews across the globe in 19 high, middle, and low income countries. The entire process, there were hundreds of researchers involved in this process, and the resulting survey, the SHAPE instrument, ended up, the survey included population level information on sexual practices, sexual behaviors, and sexual outcomes at the global level, so that different countries can compare to each other. And Leanne also discussed how this tool has been used in Thailand and in Portugal. We're about to collect some data using this tool in the US, so maybe we'll be able to present some of those results at the next WAS meeting. But it has been used in Thailand and in Portugal, and maybe in some other places now. I'd love to hear if it's been implemented in a few other places. But I'll get back to what Pedro talked about in Portugal now, because what he discussed was the population-based study that he conducted in Portugal with a randomly selected sample of over 2,000 participants who completed a mixed online telephone interview. And they used this instrument. What they ended up finding is that it was useful. It was a useful tool, and that the findings really supported how important that role of sexual health and sexual well-being is in determining global health and well-being and quality of life. So yeah, as I mentioned, this tool is free for anyone to use and to implement in their work. So you can find it online. There's a full full PDF available for download that gives you all of the instructions for implementing this tool in all settings. So the third talk I would like to feature is the invited plenary, which was the Eli Coleman Institute for Sexual and Gender Health invited plenary from Dr. Jennifer Gomez, titled "Whose Body Is It Anyways? Culturally Competent and Trauma-Informed Approaches in Sexual Healthcare." So this talk bridges that gap between what Lori, Pedro, and Leanne talked about into healthcare providers and what we are maybe looking for in how we train future healthcare providers and how important that is. So what Jennifer discussed is, well, she talked about her book, which is an incredible book. I've had a chance to read it since the Congress. It's called The Cultural Betrayal of Black Women and Girls, a Black Feminist Approach to Healing from Sexual Abuse. And in that book, there are several examples of very specific instances with interactions with healthcare providers that show the damages that can be done if someone is not trained and is not sensitive to sexual trauma experiences, but also to just the inclusion of people being more than their trauma, right? And so I know that this was a highlight of a talk for many people. She reviewed the literature on cultural betrayal theory and sexual violence, defined institutional betrayal and institutional courage, and also really focused in on some of those experiences with sexual health care. So at the end, Dr. Gomez's message was, that all doctors' visits could be culturally competent and trauma-informed, and all should be. So this talk really perfectly leads into the importance of educating medical professionals in sexual and gender health. And that brings us to the training of future healthcare providers, where you know, as I mentioned at the beginning of this talk, sexual health is a critical component of overall health and healthcare, and healthcare workers are often relied upon to provide sexual and gender healthcare to their patients, despite having very little training worldwide. And you know, this symposium, which I did organize, so this symposium really focused on providing that how do we improve the training of healthcare providers, and how do we look to formal instruction in sexual and gender health, even though it's rare, it's incredibly critical, and how do we learn from the places that have been doing some of that work to improve that. A few different, there was data compiled from Tanzania from Dr. Dixon Makoka, who is at Muhas University and is running, just finished a 5-year randomized controlled trial with Dr. Simon Rosser on training future midwives, nurses, and doctors to provide sexual and reproductive health care. And then I also have a project with Dr. Dixon Makoka, which is looking at extending that to people with disabilities. We also heard from teams in South Africa, where they're doing amazing work at Stellenbosch University in implementing a sexual health curriculum for their medical students. We also heard from medical student Tessa Brooke, who talked about the ways that their medical education was just so limited. And we also talked about data from the US from my team as well, where we have collected data on a curriculum redesign to understand where the gaps are in LGBTQ health education and also sexual medicine. So this it's really great to see that different teams across the world are collecting data on this. And I encourage, and one of the things that came out of this symposium was to encourage others to be collecting data on this. Even if it's just simple pre-post, that is better than having nothing. And I think for us to be able to demonstrate efficacy, those are the ways that we can move the needle forward worldwide on this. So thank you so much for your time. I'm going to pass it over to my colleagues, and I can be reached through these means. And thank you all. I look forward to, talking to all of you. Thanks.
Hi, everyone. Yes, thank you so much, Kristen. That was really, really interesting for me as well. I was at the Congress, but I was working behind the scenes, so I was not always able to attend the sessions and listen to all the wonderful talks. And this really gave me now a very good grasp on a lot of the things that took place that I couldn't experience myself. And I think, that was really provided a lot of insights for people who were also not able to attend. Just in terms of house rules, if you have a question, please remember to put it in the Q&A box. So that's where the question goes. And we'll get to those after we listen to Terry. I just want to thank everyone once again. I know people are moving in and out of the webinar, but thank you to all of those. I think we have people from literally every continent on this webinar, so that is really so great. Our next speaker is going to be Terry Humphreys, and he's also a professor in the Department of Psychology at Trent University, Peterborough, Ontario, Canada. He is currently the vice chair, also with Kristen, who just spoke, of the WAS Scientific Committee, and he's also a member of the Advisory Committee of WAS. He is then also the editor of the Canadian Journal of Human Sexuality and a consulting editor for the Journal of Sex Research, as well as a past president of the Society for the Scientific Study of Sexuality and the Canadian Sex Research Forum. Terry, welcome. And we are so looking forward to hearing you speak. For those of you who didn't see it last year on World Sexual Health Day, Terry also spoke on consent. And it was so great to listen to him. Always very, very insightful and wonderful to listen to his research. Thanks, Terry.
Thanks, Renee. Well, good morning, everyone from Canada. It's actually around 9:30 up here in Canada. And yeah, we just had to switch to daylight savings time. So about a week ago. So we're kind of a little bit off kilter. But I'm going to talk a little bit about my reflections from the 2024 WAS Congress as well, as my colleagues have been doing. And really, for me, I'm going to focus on tracks in the kind of social and behavioral sciences, sex education fields. Those are kind of my more interested fields that I spend most of my research in. And so my particular interest in the sessions I really like to go to is really combine sexuality with things like social psychology, behavior, motivation, emotion, personality characteristics that influence all of those things. So I really like to hear about the kind of the big picture sexual behavior surveys that are going on, that are capturing, larger portions of the population, completed in different countries around the world. And those things really speak, for me, they really speak to the kinds of cultural norms that influence behavior. So, when you get these kinds of country by country comparisons, it's fascinating to me to see how the cultural norms within the communities actually influence, and the legal systems and the social norms influence behavior. So I love to hear about the new developments that are occurring, especially around things like the World Observatory for Sexual Health, which Pedro Nobre talked about at the Congress, as well as the launch of the new World Health Organization's Sexual Health Assessment and Practices and Experiences Questionnaire. They're calling it SHAPE for short. Kristen mentioned it already as well. Those are really the kind of new ventures, the cutting edge stuff in new directions around research. The ability to gather the best knowledge on sexual health from around the world in a repository that we can utilize and provide access to. Attempts by the World Health Organization to gather new population-based data on sexual and reproductive health much more systematically by creating kind of standardized survey measures. A survey measure creation is one of my own hobbies as well in my research. So it's wonderful to see these kinds of standardized measures that are coming out that could ultimately then, do comparisons across countries or regions of the world. So it's fascinating to hear about then the challenges in trying to do that kind of work as well, trying to put those kinds of surveys together. So we heard a number of pilot aspects to the new SHAPE survey, things like different cultural understandings of certain sexual behaviors and how to communicate those or how to ask the questions within a cultural context that makes sense. Language barriers, right? The use of a particular word in one language that doesn't have a direct translation in another language or culture. And then how to describe that and still capture the essence of that in an individual question. There are also legal challenges to asking about certain sexual behaviors in some countries. So there's a number of challenges to bringing these kinds of larger global surveys to bear and getting the good quality validated data that we want to see. So those are just a couple of the examples of the kind of new innovations, methodological approaches to research and new attempts to try and bring forward the kind of best evidence-based information to the largest number of people possible. And those are the types of experiences that people get when they come to a WAS Congress, that cutting edge research, leading edge scientific research possibilities and the new ventures that are occurring. So that's one thing that I like to reflect on. Another is that I did attend actually a a pre-conference workshop that was on professional training and certification. It was a consultation, a full-day consultation on sexual health. And that workshop is it's a first step in exploring how we could standardize and certify the training that people get on sexual health, the sexual health professionals that get. It's a massive undertaking, but somebody has to start it. So, WASP jumped into the fray. And of course, this group is then grappling, in this full day workshop with basically, step one issues. Of defining what do we mean by sexual health, and how is it different from sexology, and are there existing providers that are already doing this kind of sexual health training, and what are they doing, and how are they certifying people? What are their target groups? Who are the stakeholders in this venture? How much content is required for such a certification? And who's gonna provide the monitoring of the quality of this kind of certification over time? These are big questions. And that's probably just to name a few. I'm sure I'm just talking off the top of my head in terms of, the big picture questions that we dealt with in that workshop. But those are the types of processes that always start kind of chaotically. There's so much to consider. But over time, there was a first attempt, a one-day workshop, but over time we'll have to start weaning that down to try and understand more about what exactly we're going to focus on within that certification process, to make it more manageable for a particular organization to take on or to assess and provide that kind of training. So in addition to that day-long workshop, there were obviously sessions that were related to that topic. The training issues. So there were sessions that included educating medical professionals in sexual and gender health. I think Kristen talked about that one a little bit. There were also symposiums that reviewed professional education in sexology. So looking across countries to see what kind of training and educational training professionals get in sexology. And from a number of different country perspectives. So that's always wonderful to see, who's doing what, and, is there ways in which we can learn from each other. So that was a pretty major theme, and one that I really look forward to continuing at WAS. I also remember Dr. Emily Nagoski's work or session at the Congress. Highly enjoyable, very popular session. Dr. Nagoski talked about the science of long-term relationships. And she's one of those rare kind of academics, right? The ones that are fabulous at being able to translate, hard science for the masses. Certainly her books are a big hit. This one here, Come As You Are, has certainly been a big hit. I'm not getting any kickback for that. I just admire it. And her breadth of knowledge, though, as a researcher is quite impressive. And but she also has the ability then to translate, concisely, to sum up that research and to present it simply, to people go, oh yeah, that makes perfect sense to me, but it's based on the hard science behind it. I remember her saying during her talk, sorry, very sorry about that. My phone went off. I do remember her talking during her talk, and she basically said something to the effect that she wants to get rid of that clinical term called low desire disorder, or low sexual desire. Because inevitably, when she says she talks to her couples and does the research on couples and asks, the ones that are experiencing low sexual desire, and they say, well, what kind of sex are you having? They typically describe pretty terrible sex. And they say, well, that kind of makes sense. It's little wonder that they want to stop having the sex that they're having if it's not enjoyable to them. So instead, she really thinks about talking to couples about pleasure. We come back to this theme about pleasure. And what kind of sex do couples really want to have? So starting the conversation there instead of starting it as, oh, there must be a problem in the relationship. But let's describe what is pleasurable to you and move forward from there. So it was really, at one level, very simple, but at another level, incredibly insightful to have that come out. And she was only able to join the WAS Congress via Zoom, but I recall it being a pretty packed room. So it was a very good session that way. And of course, another significant theme for me throughout the program was, my personal research area, which focused on sexual consent. But sexual consent is a new area in terms of research and education, and it is a growing area. And it fits nicely and integrates nicely into the broader themes of the Congress around pleasure and around justice, sexual justice, because sexual consent incorporates so many different elements of sexuality. You have, the basic understanding of how couples go about communicating with each other during sex, so their verbal and their nonverbal messages. There's how to increase intimacy and pleasure if our sexual experiences are consensual, maybe they're also then more intimate and have higher levels of sexual satisfaction in them because they're pleasurable. Sexual consent also speaks to sex education because a number of new ventures and new efforts in the area of sex education really focus on communication and are focused on consent itself. How do we communicate consent to our partners, and how do we give it, and how do we know that we have it from our partners? And on the flip side, when you talk about the lack of consent, then you were talking about gender-based violence. So there's sexual assault issues, sexual violence, sexual coercion, all of that whole massive area of research comes into play as well. So it really integrates well with a number of other fields. And some of the sessions at the Congress were actually focused on consent, even apart from my own. There were consent in sexual health and advocacy symposiums. There was consent in gender-based violence talks. There was a whole session on consent and abuse. And those sessions crossed a number of different tracks at the Congress too, everything from sexual rights to sciences, social sciences to education. So, of course, my own talk on sexual consent highlights it as a growing field as well. In my own session, I talked a little bit about the kind of disconnect that we currently have in the literature around people's attitudes toward consent, which seem to be pretty positive and relatively knowledgeable about what it is, versus their behaviors, which they tend to do very different things. So the attitude behavior connection is really disconnected in this particular area. I'm assuming there is in a number of others too, but I don't study those. And now I also talked about, this idea of trying to distinguish between wanting to engage in sexual activity, which is a feeling, an emotion, a connection, and actually consenting to it, which is more of a decision-making process that's more cognitive in nature, more of a cognition. So we may want to study this in different ways, looking at the emotional field and its connection to sexuality, as well as the more cognitive approach. It seems as though in some countries, there's also the concern around alcohol and its connection to consent. Certainly there is in Canada here, and the legal systems have been pretty ambiguous with respect to this. In fact, here in Canada, as an example, there have been current precedents set that say that you can have alcohol in your system and consent to engage in sexual activity. So it's starting to create this fairly substantive gray area around capacity to consent and the use of alcohol or drugs. So another, big area of study that needs much more research. And one that I just got a phone call recently from a major Canadian newspaper about, which is the consent and HIV disclosure. So again, here in Canada, if you do not disclose your HIV positive status to your partner before you engage in sexual behavior, it's seen as a breach of consent. You cannot consent to something you don't have full knowledge about, and therefore there are legal implications to that. Actually, the legal system is now suggesting that that is sexual assault. So it raises a whole bunch of ethical issues around HIV disclosure, especially with the new, U equals U ability of pharmaceuticals. So, there's all of those fascinating new cutting edge developments that I look forward to when I reflect back on what I picked up from the last Congress. And apart from the sessions themselves, WAS is I find WAS wonderful for networking. So there's amazing opportunities for networking. I connected again at WAS with colleagues that I have in Ireland. There's a number of colleagues who are doing some fabulous work in Ireland around sexual consent. They have an active consent sex education programming that's developing substantially in Ireland, and I was over there with them for some workshops, and then was able to reconnect with a few of them that came to the WAS Congress for their own talks. So that was absolutely wonderful to reconnect. I have a brand new collaborative development with a colleague in Quebec, because I was at WAS, just bumped into each other and got talking and realized that she's translated one of my scales into French, and then she has a huge data set and wants some people to start, picking it apart and helping work on it. So I just picked up that just because I was in the right place at the right time. And of course, the other thing that I'm really proud of is that I had a graduate student actually come to WAS and present her own work. So Jessica Johnson, who's my master's student, came to the WAS Congress and presented on sexual consent in the BDSM community, comparing the BDSM community to those outside of that community, and seeing whether or not their consent practices are substantially different at all. So that's one of the wonderful things that allow, the conferences allow, but the WAS Congress especially. So she got some wonderful feedback from some, attendees from all over the world. So it was lovely to see. So for me, just a bit kind of sum up, I think one of the great things about WAS was the ability to have that global perspective, to see where in the world, people are doing fascinating cutting edge work. That global perspective also gives us a constant reminder that there's so much left to accomplish. But that diversity that you see actually provides a tapestry of solutions to some of the complications that we're seeing. So we can learn from each other. And then, of course, the networking and the youth involvement in the Congress is absolutely fabulous. So I'm going to leave it there. And thank you all for listening. And I'm looking forward to our Q&A discussion.
Hello, I'm Luis Perlman, Secretary General of WAS. I'm very happy to be in this webinar, and I've been also supporting the organization of the WAS Congresses. I want to thank all speakers and participants, and of course, you are the organizers of the Congress in the scientific, everything regarding the program and scientific. So you receive all the proposals and you deal with organizing and reviewing and following up with accepting or not accepting, and you get to read and talk about all the proposals. So you have a great feeling of what the Congress is going to be about even before it happens. And it's a very, very dedicated and hard work, which I thank you for. The scientific committee is the one that crafts the program in the end. And we heard about a lot of topics around the extensive amount of topics and variety that WAS covers and the WAS Congress. And we see how WAS is more focused. The final focus is how to help support for advocacy and public policy and standard settings through research. That's why scientific the scientific committee is so important. And that's why also WAS is a confederation, and it represents all the national, international organizations and continental federations. And that is the scope of the work of WAS, and that's why the WAS congresses are so looked forward from all over the world. It's one of the few really international world meeting places. And thank you again for your passion. We do have some, I'm in charge of moderating the question and answers session. We do have several. I'll start with the first one, we learned about many different kinds of names, and we tried to pronounce them. Shazarin Khan asked about why there's not a track on sexual pleasure, considering that it's an emerging topic. I saw there was an answer in the general chat, but would someone like to speak more about why it is not? She said he or she, they about not leaving it to be left to be picked up by other tracks. Any comments?
Well, I saw Terry responded already a bit to that. I think in the future it's a possibility. The tracks try to be a combination of topics, themes, but also representing professional disciplines. So that makes it a bit harder. Sexual function is something that is also could have a track of its own, the sexual dysfunction, but because it's clinical, but there's also very basic science being done, and there's also more public health aspects to it. But I see your point, and it could be if there's enough, focus on it in terms of people doing work in that area, and because the tracks are also there for us practically to organize the meeting and to categorize abstracts, etc. So at this point, I don't think it would be a very. We're not there yet, but it is a possibility for the future, depending on a number of factors.
Thank
I'll
you.
just add to that. I think there is also a benefit to integrating it throughout all of the tracks. And as researchers think to try and be more inclusive of sexual pleasure, that is one way to do that, right? Like take your work that you're doing and find ways to put a pleasure lens on that. And so although I think it would be wonderful to have a pleasure track, there's just not enough of that yet that we're seeing to make a separate track for it. When we start to see the abstracts come in that are really emphasizing that, hopefully we can make that change.
Yeah, and I think just to riff off that a little bit, I mean, the concern obviously is that if it doesn't have a track of its own, it kind of falls through the cracks, right? And it doesn't get picked up by any of the other official tracks. But I think we have to also remember that with a sexual rights focus that WAS has, and a pleasure a document on sexual pleasure, that we are really focused on making sure that theme, that topic is picked up across different tracks. So rest assured, it will continue into the future.
Okay, thanks all three. And if you have more comments on this, you can also answer directly on the questions Q&A box. There's another question on. I'm grouping a little bit. If the speakers could address more on sexual rights and justice aspect for WAS for the coming year, in terms of sexual health research for the global South, thinking about minorities and marginalized, and thinking from asset framing or positive lens to look at sexual health.
For WAS for the coming years in terms of sexual health research for Global South. I'm not sure how to best address this. I mean, the WAS, obviously, we don't do research ourselves, but we welcome all presentations, and we, of course, very much support those kind of initiatives. So in terms of sexual health research for the Global South, I'm not sure. It is something that we take very seriously. We try to create as much room as we can in the program of the conference every time. But we don't have the means financially to stimulate or support research initiatives at this point, which actually, it would be wonderful if we could.
And I think there's also been talk of potentially hosting a Congress, for example, in India. Like that will hopefully draw more folks in from the Global South. And obviously there's different definitions of the Global South, but I think the location of the Congress can also then bring more of that flavor into WAS. And that might be one way to do that. And I think that there has been talk of doing a Congress there soon. So
thank you. And we also participate there are many members of WAS that organize national congresses. So we are invited. WAS organizers or members of the WAS AC are participate in other congresses also. I'll take now the two questions around male genital cutting or circumcision. And there's the first one, even within sex-positive organizations like WAS, there's a resistance to discussing the impacts of MGC. As scientists, we're also, each of us, coming with a set of cultural backgrounds, religious backgrounds, where male genital cutting is seen as important. Advocacy backgrounds that see a focus on MGC as a distraction from female genital circumcision, or from medical cultures where male genital circumcision is seen beneficial or at least not harmful. So the final question is, there's ample evidence that was presented. There was a symposium and WAS that maybe you can talk about, and how can we decrease the resistance to this discussion in an otherwise sex-positive organization like WAS? And it ties with the next question about why they're not put together like childhood genital mutilations. So, and they would like an answer. Mm-hmm.
Not sure if Terry or Kristen, you want to respond? My take, this is not an area of my, and at least not in my research of my expertise, but I cannot, it's a bit hard for me to evaluate to what degree or where your impression comes from that would be resistant to a discussion of that topic. From my perspective as the chair of the scientific committee, I can reassure you that from the scientific committee's perspective, there's absolutely no resistance to discussing this at all. I think it's a very important topic, and the various ways of we embrace controversy and complexity, and it can be through all kinds of ways: discussions at the conference, debates, presentation, symposiums with different takes on different topics. So that's the one thing I don't know exactly how to respond to, is why you have that impression. But from my perspective, and I hope that my colleagues here agree, we do not have experienced any resistance to focusing on topics that are complex, challenging, and that so many of the things that WAS deals with come with different perspectives. And,
yeah, not an area of research of mine either, so I can't really comment on the particulars of it. But certainly, I concur with Erick's assessment that as a scientific committee, we don't have any qualms about broaching these kinds of subjects. So
we welcome submissions
your
for
submission.
any type of, yes, for the next meeting, which will be in Australia. I'm sure Renee might say still something about it. I'm not sure, but we definitely welcome all kinds of submissions for presentations and discussions, so, including on this topic.
Oh, you're muted.
Yeah.
I know Zoom in the Congress, and then there were people dedicated. I did not participate. I can tell you that I'm almost sure there will be, now that the recordings of what happened in the main room will be up. So I think I'm almost sure that symposium will be a part of it. If not, it'll be in the abstract book, which will be published in a not too far future. I'll go to the next. Is there any from Surya? Do you have any recommendations on papers that delve into sexual health and neurodivergence?
I haven't published in this area, and I do think it's like a growing area of research, especially as we see. So one area that I've started to kind of go into is adult ADHD and the sort of estrogen interactions that are happening in the decrease in estrogen, and how that impacts executive functioning, and then how there's some overlaps of that with like ADHD and autism spectrum. So that's the only area that I'm like a little bit familiar with, and I would not claim to be an expert in it yet. I think in terms of that field, though, it's really growing. And I think there's an acknowledgement of the relational complexities, especially, and how they interact with the sexual health of people who are neurodivergent. And so that's just a growing field, and hopefully some of you will submit some abstracts in that area for the next Congress. I don't know of any papers specifically to recommend for you.
There has been some
Sorry.
on the area of consent and neurodiversity. So, and again, I'm not an expert in the field, but I know it because it's a related field to consent, the consent area. But cognitive capacity to consent has been something that has been talked about. I remember a number of papers and a talk a number of years ago on that topic, and I haven't seen a lot since. So it's interesting that it hasn't. At least maybe I'm not familiar or haven't kept track of it in detail, but I do recall, at least from a Canadian context, that there was some discussion in that area. So it specifically, it kind of falls along the lines of either neurodivergent, youth and their capacity to consent, or it gets at the aging aspect as well. So those with dementia or Alzheimer's, declining cognitive capacity, and still being married, living in a long-term aging complex, and trying to negotiate their sexual being, their sexual essence with another person within the center. So those are two kind of areas that I am somewhat familiar with, but again, not an expert. Luis looks like he's frozen. There he is. You're back.
Any more studies or interventions that you can mention?
Well, there was a great one just suggested in the chat of a book on exploring sexuality and disability, a guide to human service professionals. Maybe perhaps in that book, there's a chapter on neurodiversity. I think those are some of the places where some of this research is getting collated.
Yeah, please. If people who are listening to our talks know of the great resource, make sure you get them into the chat section so you can help out with some of these questions.
We have about 5 minutes left. There was a comment from Alejandra talking about certification. It would be great that WAS could incorporate a basic program with the basic topics that every healthcare providers in the planet should know, like a common ground to start with.
That's fascinating. I wonder if there could be, and again, I'm talking off the top of my head, so be careful, because I'm not the leader of this organization. But it does seem like WAS could have an opportunity there to provide some training with some certification on just basics, right? To get everyone up to speed, in different countries, that they could start to get some of that. So it's a novel idea, absolutely. It's a resource intense idea, but it's a novel one for sure.
One thing that oh, go ahead, Eric.
Well, I was just wanting to add that it is actually something that has been discussed internally, and it's would have been great to have our president, Elna Rudolph, here, who I'm sure could go into this a bit more. But it is something that we have been talking about, providing more basic educational, informational materials, not just for consumers, for people in general, but actually for also healthcare providers. But yeah, it involves a lot of steps and a lot of work, and to do it well will take time and effort. But it is a great idea and suggestion, and something that internally has been a topic. Yeah.
Or at least to have a list of where that stuff is available, right? Like, I think that there's also something to be said for not reinventing the wheel. There's a lot of places that are offering this sort of thing, University of Minnesota being one of them. But it is definitely something that I know that the Education Committee has been working on. They sent a survey out to all of the all participating organizations to sort of list out the components of the different areas that are doing education in this area. And I think having even just perhaps WAS houses a list of all of those different opportunities, so that some are more accessible than others to different people in different parts of the world. And I think that is definitely being worked on. So whether we offer it ourselves or refer to our reputable organizations that are already doing really great work in that area.
And it's partly related to Pedro Nobra's initiative, which knowledge base, more or less, of relevant topics. But yes, the thing is, do volunteer to help us. Be involved, get involved, sign up for committees, because it is all volunteer work. WAS is.
There's a question from a comment on that from Erica Silva, or together what organizations are using to train providers. Yes, part of the work I can mention is to identify all those that are working around the world and try to bring them together so that we reach a world consensus. That's one of the projects. From Benedict, can attract, who I met had the pleasure of meeting in Antalya, can attract focus specifically on local factors such as policy frameworks that inhibit the inclusion of sexual pleasure. It is well established that sexual pleasure is well aligned with CSE, which is equally political and cultural opposition in many contexts. So about a specific track focus for local factors.
It seems like this could be integrated into the policy sort of world of, we have a track. What is that track called, Eric? There's a track related to policy, and
Public
I think
health and policies, I think.
Yeah. And so I think integrating that into, what an amazing symposium idea, to have a symposium with people from across the globe talking about what are the local factors that they're facing in policy that's inhibiting the inclusion of sexual pleasure. That is a great. Benedict, you've just created a wonderful symposium. I hope to see it submitted.
Fully agree. So the tracks are the tracks are one way to organize a congress and submissions, and indeed areas of relevance. But we have also within the tracks and across the tracks what we call topic lists, and that list is kind of very long and can always get longer. And so to me too, this sounds not necessarily as something that would require a separate track, but we would welcome any submission for, as Kristen said, for symposium or presentations in this area.
Yeah, we almost always find a place for every submission or most of the submissions that come to us, regardless of the topic area. They usually almost always fit into one of the tracks, or we figure out how to make them work.
And the tracks, again, they are a tool, they're a guideline, they're a way for us also to keep things manageable. But when you submit something for a WAS Congress, you are the one who assigns your own work to a certain track. It's not we. We don't say no, you're wrong. This should be the clinical track. So it's your own choice, and yeah, it can be a bit limiting. We can also say you can choose 5 tracks, or you can create another. But it's I think what's much more important is that things are present and being presented at WAS, and so there are no limits in that sense.
Sorry to interrupt. The guillotine of time has arrived. I would ask only the 3 of you if you have, in 5 seconds, any concluding mentions or how you would like to say to close this webinar.
For me, thank you all for your presence. It's nice to see that quite a few of you have shown up. I hope you found it somewhat interesting, from the somewhat more abstract reflections to very, specific topics. And I wish we could indeed provide more references. I'm not sure if that's going to be that easy within the context of this webinar. People have been asking for that, but feel free to contact us, and we'll try and help you as much as we can. Terry, Kristen?
That was
thank you
a
everyone
great
for
conclusion.
coming.
I'm not going to add to that at all.
Right. Yeah, we hope to see you. We hope to see your submissions for the next WAS Congress, and thank you so much.
Thank you all. Thank you for all the participants in attending. Thank you for your enthusiasm, and good day, in my case, from Mexico City, but for all the world. And thank you, Renee, also for helping to moderate. And thanks to Alain, who was introduced the webinar. Thank you all, and good day.